Guru Nation, thank you so much for watching. Make sure you like, subscribe, comment, share. Really means a lot to me. Listen, I'm so sick and tired of the fear porn, the doom scrolling, especially on LinkedIn. Like, I totally get and I understand. First of all, the layoffs, the clinical research layoffs from private industry preceded the any layoffs from the fallout of NIH budget cuts and academic medical centers, which is still yet to come. Like the majority of that shoe has yet to drop. But those of us in private industry, listen, we've been struggling since last year, since 2020, since early 2024. Robert Goldman and myself and Chris Sabra on Guru After Dark constantly. The reason we created the Guru After Dark was because we started seeing the cracks in the surface, and Robert Goldman called it out first. He's like, man, these CROs are laying off, and I think we've stabilized with the CROs. There's still a few fallouts. Icon has some funny stuff going on Reddit. I don't know. I haven't been researching that. I've been focused so on the NIH because on LinkedIn it's been absolutely insane with the fear porn. What's the old adage? It's a recession when your neighbor loses their job. It's a depression when you lose your job. And I think there's a lot of that happening right now on LinkedIn with people that have had very cozy, comfortable jobs that are getting rude awakening, right? And whether you agree with it or not, honestly doesn't matter. It's reality of what's happening. And the American people voted for this administration. They probably didn't realize it was going to be this crazy, but if you're trying to balance a budget, and it looks like these guys are serious about it. Believe me, I'm a site owner. Like, the last thing site owners want is like rocking the boat, especially when you have a stable business. But the boat's getting rocked for sure, and my job is to inform you, viewers, and it's also to make sure that my businesses and my employees are stable because the fallout from this may affect me too. Like basic research, like 5, 10 years from now, we don't know if there's gonna be innovation. I think I'm an optimist. So I think there's always a way. And this is why I'm telling you guys, I've been reading Stoicism. The Daily Stoic by Ryan Holiday, Marcus Aurelius, Epictetus I have here. I've been doing a lot of philosophy. Plato, The Last Days of Socrates, Epictetus, Nietzsche. Like Charlie Munger actually got me into all these readings. With the mental models. But like to expect that nothing will change and things will stay the way they are forever is crazy. And right now it's easy to blame Doge and the Trump administration and Elon Musk. But like at least in private industry, the cracks have been showing. And like in the public industry, no one expected the NIH ramifications to fall out that much. But when you have an inefficient system, which I had a lot of feedback from my last article I wrote, where I tried to be pretty balanced, because just to let everyone know, politically leaning, I am an independent, I'm a moderate. I'm fiscally conservative, socially liberal. And so I try to always see both sides of the coin. When Trump's in office, I try to see both sides of the arguments when Biden was in office. I mean, let's just face it. Let's just call it what it is. That was a disaster. But like when Obama was in office, I tried to be balanced. I had I have the receipts to prove it too. We had live streams with Darshan going way back to 2015 talking about when Trump was first got elected. So there's a lot of doom scrolling and a lot of fear porn. And a lot of people who were not so concerned when their colleagues were getting laid off in private industry are now all of a sudden crying that this is unfair now that their jobs are at jeopardy. All of our jobs, mine included, are at risk constantly. When you're an entrepreneur, I think it's easier to understand this because we truly eat what we catch. And I've learned this over 2 decades of doing this. And I've struggled some years. Other years I've done really well. Like I said, I'm in a stable situation now, but I'm still preparing. How is AI going to put my site out of business? How are these potentially NIH cuts going to affect basic research going forward? I don't have all the answers, but I just researched another article, a follow-up, because I got a lot of comments from the last one about labs struggling financially from the academic medical centers and the NIH, PhD candidates and postdocs earning below poverty level income, as is, by the way, before Trump, poverty level income for PhD candidates and postdocs at AMCs. And many of these AMCs have healthy endowments. So if we're going to start getting mad at anyone, we should be looking in those directions as well. I'm not saying what Musk did. I was actually pretty critical of Musk's layoffs or Musk's cuts. I thought he used the sledgehammer when he should have used a scalpel. But I think what's going to happen now is they are going to go in and get surgical with it because there's been a plot twist. The Department of Government Efficiency, so DOGE, the lady running DOGE is a lady named Amy Gleason, who is a patient advocate. Like, you want to talk about patient centricity? So some of the comments, let's go back a little. Some of the comments from my last article on LinkedIn, and I'll link to that one underneath this video. And this one will drop Saturday. So if you're watching this right now on February 26th, I'm gonna drop it February 28th. But well, actually, I may drop it earlier so you guys can see it tomorrow. I'll drop it tomorrow. But some of the comments were, hey, lab struggling financially, PhD candidates and postdocs earning below poverty levels, um, massive NIH related layoffs, of course, when your neighbor loses their job, it's a recession. When you lose your job, it's a depression. And fears, here was my biggest concern. Fears that rare disease research could stall without NIH support because the argument has been, well, there's no profit in studying some of this basic science, like the basic research. And that's true, and I wrote about that last time. But there actually is, there's something about constraint that make innovation happen quicker. Necessity is the mother of innovation. And when I researched this, and I used Grok 3 and I used OpenAI, like we'll get into that. But somebody reached out to me via text and said, "Hey, did you know there's a plot twist? Do you know who actually runs Doge?" Yeah, it's Elon, but the day-to-day administration is someone named Amy Gleason. And I think she took over, let's see when she took over. I think she took over today, February 26th. Amy Gleason is the acting administrator of Doge after the White House struggled to answer who is technically at the top of the org chart. Gleason assigned to comment on her appointment. I did some due diligence after I was told about this headline because it just happened today. Shout out to the person who told me we gotta do an interview, by the way, one of these days. You know who you are. She's a patient advocate. You cannot be more patient advocate than she is. She has a 2020 TED Talk calling for technology and data changes to improve healthcare outcomes. Her daughter was diagnosed in 2010 with juvenile myositis, rare disease, prompting her to serve as vice president of research for the Cure JM Foundation for 4 years, supporting families and funding research, a passion she further expressed in her 2020 TED Talk, which I'll have the link to this article underneath. So I embedded her TED Talk in that article. Bottom line, she's been advocating for rare disease patients for over a decade and a half, inspired by her own daughter's condition. You actually couldn't have scripted this more favorably for rare disease advocates. So this person's not just running, let's just make sure we understand what's going on here. Amy Gleason is not just running the cuts at NIH. No, no, she's running the entire Department of Government Efficiency. Like everything. The NIH is just a part of it. Like every place they're cutting, Department of Education, whatever. She's running all of it. I don't know how long it's going to last, but they just named her today. This is clearly not, in my opinion, someone putting profits over patients, because like some of the biggest criticism Musk has been receiving is that, well, he's only doing this for himself or for his friends. Incentivizing private industry is like you can't be more American than that, right? There's another book, I'm going to point to it again. Ayn Rand, The Virtue of Selfishness. It shouldn't be, I believe government should, and I don't agree with this 100% either, but I agree with it like 90%. Government should not, I believe government should have a social safety net. That's Ayn Rand right there would call me a moron. But I don't think government should be in charge of moral policing and regulating, over-regulating who's to do what, and well, it's because it's not fair. I think private industry and the citizens should do that. And I do think there is a model of efficiency that comes from a private-public partnership. And upon doing some more due diligence, because once I learned about Amy Gleason, I went and looked into this a little more, other things. And there's a group called the ARC Institute, and it's run by the co-founders of Stripe, the Stripe brothers, Patrick Collison and John Collison. And it's a private alternative. It has $650 million in funding. Based in Palo Alto, they partner with Stanford. It provides investigators with 8-year fully funded appointments. There's no grant writing burden that consumes an estimated 20% of researchers' time. And they use AI. They've been using AI, and one of their tools is called Evo 2. It's trained on 9 trillion DNA base pairs, and it achieves 90% accuracy in genomic predictions, accelerating advancements. There's a really good article about this from article, this newsletter called Freethink, and they wrote about this in 2024, last year. Um, but they're funding research. And not only that, they're funding rare disease research too. And they're funding genetic conditions. And another side note, because it's not all doom and gloom with this administration, however you might feel about RFK and his stance on vaccines, which I just think he's going to be calling for more long-term studies of vaccines, but whatever, put that aside. He had to disclose his financial interests. He owns a lot of CRISPR genetic therapeutic stocks, right? And I think he had to get rid of them, but he's not anti-science. CRISPR stocks, like gene editing stocks. So that alone, like, forget about what you say, it's what you do, where you put your money. He's invested in research. And so that's another side note I wanted to get into, but this ARC Institute and their model for long-term vision partnerships with Stanford, with UC Berkeley, as well as with private industry, is sustaining research with or without federal cuts, doesn't matter. This is, I believe, a scalable model for innovation. I wrote a business plan for an academic medical center in 2019. In this article, I share the slide. We revised it for Latinos in clinical research. Hopefully picks back up, but it's essentially creating public-private, like creating community-based research clinics near academic medical centers so that they can offload some of their research to us with less regulatory bloat. We can use central IRBs, they have to use local. We can actually do a better job recruiting patients than I believe they can. We can do less with more, all that kind of stuff. That slide is in there too. But obviously, you can't go from 45 billion annual budget that the NIH was overseeing to a $650 million ARC Institute. Like, that's not even a drop in the water. I think it provides a valuable framework. And when I did more researching with Grok 3 and their deep search capabilities, it had to think for like a couple minutes, but it came back with other organizations that actually are doing it, something similar or have potential. The biggest one is the Howard Hughes Medical Institute. It's been around since 1953. and it's had over $22 billion from Howard Hughes' estate. It's already supporting 250 investigators across the U.S. Long-term, flexible funding, often exceeding 5 years, averaging $1 million annually per researcher. And this mirrors the ARC's 8-year fully funded appointment. You don't need competitive grants. Don't worry about wasting 20% of your time on that. Not to mention 60% of your budget on like indirect costs. They're focusing on biomedical research, including rare disease like cystic fibrosis, muscular dystrophy. There's another group, Recursion Pharmaceuticals, and they're leveraging AI to enhance drug discovery, specific emphasis on rare disease. So founded in 2013, they use machine learning to analyze cellular data. They've got potential treatments for over 100 rare conditions and a pipeline that includes REC-994, which is currently in phase 2 for cerebral cavernous malformation. Unlike ARC's open source Evo 2, that's another shout out to ARC Institute. Their AI is open source and it focuses on genomic predictions. Recursions is proprietary, but it has a $1.5 billion market cap. And it's supported by not just venture capital, but partnerships with entities like Bayer. So it's a for-profit approach, complete contrast with NIH's slower pace, offering a commercially viable path to rare disease solutions. But there's more. And if I would search AI for another 10 minutes, I could find more examples. Vertex Pharmaceuticals and the Allen Institute, they illustrate private industry's potential to bridge the gap. Vertex has been around forever. They're actually the subject of a book, The $1 Billion Molecule. I interviewed that author on the podcast before. $120 billion market cap. Transform cystic fibrosis treatments with drugs like Trikafta, generating over 7 billion annually. And supported by the Orphan Drug Act's incentives, the Allen Institute has a $2 billion endowment, employs full-time scientists on long-term brain science projects, such as mapping neural circuits for rare neurological disorders without relying on NIH grants. These efforts align with the readers, fair compensation. So unlike the NIH, some of the PhD postdocs living on the poverty lines. Like these are fairly compensated, stable employment. So enough with the fear porn. Finally, today, Eli Lilly and Company announced that they are allocating $50 billion in CapEx spending. So that means capital expenditures to build at least four manufacturing facilities in the United States. And according to their press release, at these four new sites, Lilly expects to create more than 3,000 jobs for highly skilled workers, including engineers, scientists, operation personnel, lab technicians. This is important because these are a lot of the same roles that are going to be gone from the NIH. So there's already 3,000 jobs right there just from one company. The other companies I mentioned, they're leaner than Lilly, but shout out to Lilly for doing this. Additionally, the company anticipates it could create nearly 10,000 construction jobs during the development of the site. And I don't want to get overly political. Apple made a similar announcement yesterday. Like policy, if you do focus on bringing jobs to the United States, and you say what you want about tariffs and all that stuff, I'm not studying tariffs. I have to actually study it more. I've been studying this kind of stuff. But after 4 years of just maintaining the status quo, we have an administration that's actually trying to improve the situation. And regardless of how you feel or I feel about deportations, I'm a immigrant myself, not born in the US. I don't have to agree with everything. I don't have to say everything's fear porn and doom scrolling either. And I encourage you guys to do the same. There's no black or white. This guy's a rapist, whatever. That's between him and God. But we've got to start looking at these things objective. And The jury's still out. This is a developing situation. And they're gonna make mistakes. Not everything's gonna be perfect. There's gonna be more layoffs. There's gonna be crazy chaos. But ultimately, it's for the mission of balancing the budget. And we had to do that at some point. That much I do know, and I have been studying. And you don't get there without people getting upset. I think I'm a firm believer in private industry. I'm living proof that private industry can support employment. I've had small sites and small businesses my entire 2 decades. We've probably supported over 100 employees during that time period, not including the owners, like myself and my business partner, just employees, and not including vendors that we worked with or contractors that we worked with. So I do think small business and private industry in general has been underrated. And I do think this administration actually appreciates, at least I hope. And if I'm wrong, this video will be my receipt. Let me know what you guys think. Hope I don't lose too many subscribers. And make sure you go check out the newsletter, see what you think. Like, subscribe, comment, share. Bye bye.